Hello, my name is Amelia. This is Terry. Tell us why you're here.
Well, hello, my name's Dr. Theresa Porrett, and I'm here to talk about my favourite subject, which is my job and the NHS, and I love it. So thank you for the opportunity to talk about my job.
So what inspired you to get into the healthcare? Was it a person?
No, this sounds a bit of a sad story, actually, but from the age of 5, I always knew I wanted to be a nurse. And so from the age of 5, I planned what I would need to do to be able to be a nurse. Now, at the age of 5, did I have any idea about what being a nurse meant? No. But I knew it was something that was about caring for people, that was about trying to help people at the time when they're most vulnerable. And I thought, that's what I'm meant to do. So there's no medical background in my family whatsoever. So there we go. So from the age of 5, I was going to be a nurse.
So you said that when you were in school you had the qualifications you'd be able to become a doctor. Why did you become a nurse over a doctor?
Okay, so that's an interesting subject because I think people assume that if you're a nurse, you're not as clever as a doctor, or you're a nurse because you can't be a doctor. And in actual fact, could I have got into medical school? Absolutely. I wanted to be a nurse. Okay, so I was more interested in supporting a person to cope and live with their disease or illness or get better, rather than the cure, the treatment, the cure, but about looking at the whole person and managing them. So I had to resist. So the school I went to, it was a convent, and the nuns were, but really you can be a doctor. We want you to be. But that's fantastic, and if I wanted to be a doctor, I would. But I want to be a nurse. So, yeah, it was a difficult decision, as in I had to push against what people said I should do. But I don't regret one second of it.
So, is there any point in your training where you wanted to give up?
Never.
Or you felt like you could?
No, never. I had some, as I explained to you, I knew I wanted to be a nurse, and I knew it was about supporting and caring for the whole person and their family and their healthy lifestyle and all these kind of things. But I didn't actually really think about what you had to do as a nurse or what I might see. And I can remember in the first week we were in the School of Nursing, and I was sat in this lecture theatre, and a very eloquent matron type, quite austere looking, was talking to us about what it was like to be a nurse, and was explaining about how night duty is difficult. And I can remember sitting there thinking, nights? You mean I've got to work at night? Because it had never occurred to me, And I was like, okay, well, it makes sense, and it was fine. But so things that you might have thought I would have looked into and knew what I was going to be doing, I actually didn't know. But I loved every minute of it, from the first few weeks in school where you learnt to do an injection in an orange, to going onto the ward the first time and meeting patients and talking to them, to even the first time at the age of, so I'm 18 years old, straight from school, and the first time, unfortunately, that one of the patients I was looking after, and he had cancer, and he died. And it was the first time I'd seen a dead body. And I was a little bit scared, actually. And the ward sister said to me, look on, we're going to prepare this gentleman for his last journey. We're going to clean him up and make him look nice, and his family are going to come. And I was scared. And she said, Theresa, you've looked after this man for weeks and you got on really well with him. This is the last thing that you can do for him, that anybody can do for him. What a privilege. And then I wasn't scared anymore, but I was really scared at first to touch, But there's not been one, I've never woken up when the alarm's gone, to go on a shift or go to work and thought, oh, I don't want to do this. Not one day. I've loved it. It's challenging, it's stressful, it's emotional, you get attached to people, you get attached to their family, you want everybody to do well and live and go home and be happy. But actually life isn't like that, and you have to cope with those ups and downs. But nurses do have a really good coping mechanism, which is a slightly warped sense of humour. So we laugh at things, not at work, but after work. You laugh at things to dissipate the stress and things. So nurses do have a bit of a warped sense of humour, but other than that, no.
Yeah. So who's your most memorable patient?
Okay, a gentleman called Sydney on the ward when I'd qualified, and it was my first ward as a staff nurse, and it was a surgical ward, and he had a very complicated problem, and he had surgical treatment for it and was in for a long time, and I got to know him. He was an East End guy. He used to work on the docks in the East End. Really honest guy, great sense of humour, and his wife. And he went home, and he was well at home for a few months, and then he came back in really unwell, and his cancer had come back, and we nursed him on the ward for about 3 months, and he died. And he was like a surrogate granddad to me. We just got on so well, so that there was an understanding. If I had a day off, and if anything were to happen to Sydney and he began to deteriorate, they would ring me at home, because I absolutely had to be with him when he died. And I was. So, yeah. So, and it just his humour, the way he coped, the dignity with which he coped with the situation he was in, a very complex situation. The relationship with his wife, how well they got on, even though they kind of bickered and the little arguments. And he just really, because I got to know him and his family for so long, and his sons, who ran a fruit and vegetable stall right outside the London Hospital on Whitechapel Market. I'll never forget. And I learned a huge amount from him about how to support people in situations like this. So, yeah, Sydney.
Oh. That sounds nice.
Yeah, he was.
So, why do you encourage people to get involved with the NHS as a career?
Well, I think people think there's only 2 careers in the NHS. You can either be a nurse, and you're only going to pick a nurse if you're not very clever, but otherwise you're going to be a doctor. But actually, there are hundreds of careers in the NHS. If you're interested in finance, you can do your degree at university and then do an accelerated program in the NHS and be a finance director, responsible for £1 million budgets and providing care for patients. So if money and numbers is your thing, you can still work in the NHS. If you like science and experiments, and then you can still work in the NHS. You can either work in the laboratories where you're diagnosing illnesses from blood and from sputum specimens and other, I won't mention at this at this time. If you're good with maths and physics, you can still work in the NHS, and you can actually be at the forefront of potentially gene therapy and curing cancer. How fantastic is that? If you're really sporty or you like kind of activity, you can be a physiotherapist and look at working with people to help them following a stroke or an amputation, or even just after surgery. There's so many things. And of course you can be a nurse, and you can be clever and be a nurse. And you can go to university and you can get your nursing degree, you can do a master's degree, and like me, you can do a PhD and be a doctor of nursing. Or you can be a doctor, and you can be a cancer doctor, a physician, a surgeon, cardiothoracics. There are thousands and thousands of options for you in the NHS. And anything that you do in the NHS, from being a porter or a ward clerk to the most senior consultant, every single person in the NHS is actually providing patient services and making life better for patients. How good's that?
Yeah.
So yeah, come and work in the NHS. It's brilliant.
So you got your PhD in nursing. Why should people or younger generations be thinking about getting a higher education?
Oh, I think it's really important. It's important for you personally, for your development. It stretches you, it makes you think, it exposes you to other people with different kind of perceptions or perspectives on life. It's a time to make up your mind whilst you're studying, doing your first degree, about what you really want to do. And then it gives you options. You can then go into a career using your degree. You may stay on and do a master's. If you're a nurse, most nurses now, so they do their degree, their 3-year degree at university. They'll then have some kind of clinical experience as a staff nurse. They'll decide, do I want to work in surgery? Do I really want to work in renal medicine and help people on dialysis? You find what you really like. Then you'll do a master's, and that allows you to really develop more clinical expertise because you know the evidence and the theory around things, and you do some research for the first time. And then you can do a PhD, and that's about original research to actually develop nursing services to improve things for patients. So, and you don't have to do it all at once. So I'm not going to tell you quite how old I am, but I'm old. And I started my nurse training in 1979. And when I did my nurse training, it was in a school of nursing, because nursing wasn't attached to a university. Now, nurse training is in a university. And you do 3 years, which is the same that I did. So when I finished my nurse training, I didn't have a degree. I was a state registered nurse, but I didn't have a degree. And actually, once I'd decided that I wanted to specialise in the field that I do, I went straight to do a master's, because I had so much expertise in the field that actually I didn't have to do the BSc. I went straight and did the master's, and then I did my PhD 4 years after that. So so it's a good thing.
Yeah.
But you can stage it out, so you're not studying for years at a time kind of thing. So yeah. But it gives you the confidence to be able to have conversations with people, more senior people to you, and put your point across, which in nursing is really important, because nurses are advocating for patients. They're explaining about what a patient's wishes are, and making sure that the rest of the medical team, the multidisciplinary team, really understands that person as an individual, not just as a cancer patient or a dialysis patient. So you have to learn to be articulate and stand up and justify what you're saying and why that's the right thing for each individual patient. It gives you confidence to do that.
So we have your dog here.
We
been
do.
Said to be a therapist dog, kind of.
Yep, so this is Alfie, fast asleep, but I will lift him up just so that you can see him. So Alfie is a pet therapy dog, and there's a bit of a story to Alfie. So my mum developed dementia, and when we first went to the memory clinic and she was diagnosed, the consultant said, "Did your mum ever have a pet?" And I said, "Yeah, a few years ago she had a bichon." And he said, "Right, rehome and get another dog, because that your mum will remember how to look after the dog, and because she's looking after the dog, she'll be more able to accept that she needs somebody to help and care for her." So I thought, okay, that sounds good advice. So we rehomed Alfie when he was 3 years old, and he lived with my mum for 3.5 years and absolutely changed her life. So she would take him out for a walk, but she wouldn't leave the house before we got him, because she was frightened she wouldn't find her way home. The dog took her home. She would walk, all the neighbours would come out and they would talk to her because she was with the dog. So her social skills and communication were better. And then eventually when my mum moved to live in a dementia care home, very small care home, we would visit 3 days a week, and it became apparent that he was really, really good with dealing with people that can get stressed, agitated. He would calm them down. So when my mum died, I thought it would be a really nice legacy to carry on visiting care homes like this or other places, so that he could kind of work his magic for other people. So there's a charity called Pets as Therapy, and you apply. You have to have a DRB check, so to make sure you as the owner, you know, is can be trusted. The dog is assessed in lots of different stressful behaviours to make sure. Oh no, I thought he was going better. To make sure that his behaviour isn't aggressive at all, or, you know, if somebody were to pull him, he wouldn't snap at them, he'll just walk away. And so he passed his assessment, and so we now visit other care homes, hospitals, hospice, and I do it maybe once or twice a month. We go at the weekend, and I just think it's a really nice thing to be able to do.
Yeah.
Yeah.
Have you got anything you'd like to tell us from anything?
Okay, in general, I'd like to say that we work a long time. You know, most people, unless you win the lottery, we work. So from the age of 18 until you're 50 or 55 or 60, most people are going to go to work for some period at that time to earn money, buy a house, pay the mortgage. Do something that you really like. Don't do something just because it pays lots of money. Do something because there's a point to it. Because every day you've got to get up and do that job and do it the best that you can. And if your heart isn't in it and you don't really want to do it, then that's such a waste, because we spend a lot of time at work. So pick something that you feel you can make a difference to other people or society more widely. Don't pick a job just because it pays more than another job. Pick it because you want to do it. Life's too short to do things like that and not enjoy it. That would be my... that's what I'd say. So
Thank you.
make a difference. We can all make a difference. So do something and make a difference.
Well, thank you for interviewing today.
My absolute pleasure. And I hope that this, encourages people to look at, huge variation in careers in the NHS, just quite how challenging they can be, but how much of a difference that you can make to people. Even as the director of finance, you don't have to be hands-on, clinical. There's so many different careers in the NHS. Thank you.
Well, thank you. Yes, thank you.